799-gram female newborn. Initial examination shows a clunk when the left hip is abducted, flexed and lifted forward. Classical clinical examination findings of congenital dislocation of the hip. A previously healthy 72-year-old man comes because of a decreased urinary output and serum creatinine is 3.5. There is a suprapubic fullness, there is an enlarged prostate. Then what is the most important next step that you want to do? Now what he is having is a bladder outlet obstruction. So catheterization is the most important thing that you need to do in order to relieve the misery of this elderly man. 12-month-old boy, 2-week history of persistent cough and wheezing, and the expiratory wheezes are heard on the right, and inspiratory chest X-ray is being shown to you. So what is the most likely possibility? So typically in case of a 12-month-old boy with a 2-week history of cough and wheezing with a hyperinflation of the lungs, you should think of the possibility of foreign body aspiration leading to the obstruction of the right bronchus. Typically right side it is more vulnerable, and that is leading to the hyperinflation of the lung with a depressed diaphragm is what you are able to classically see. 2 hours after undergoing a right hepatic lobectomy, the patient has a distended abdomen and her pulse is 120, BP is low, 100/60. Then what is the most likely cause? So after lobectomy, the clamps that you have placed, if there is a poor hemostasis that you achieved, then that can lead to development of an internal bleeding which can be responsible. After undergoing a laparoscopic cholecystectomy for cholelithiasis, patient develops hematomas at all the surgical sites, and the laboratory studies are typically showing a platelet count of 45,000. So what is the cause for this thrombocytopenia? So typically she has undergone the surgery and she was being given heparin, and heparin can lead to HIT syndrome, that is heparin induced thrombocytopenia. There is a HIT type 1, type 2, there is a lot of story about the HIT. So you need to review heparin induced thrombocytopenia today evening as one of the important topics. One more clinical vignette in NEET PG you should be in a position to answer. 2 days after undergoing a surgical repair for an abdominal aortic aneurysm which is ruptured, the temperature is 38.1, breath sounds are absent, trachea is shifted to the right, and what is the most important next step in the diagnosis of this patient? So the patient has the development of a tamponade happening on the lung because of the presence of the fluid. So needle aspiration of the left side of the chest is considered to be the important part of managing this case. So doc, with this we come to the end of the today's session. So every Sunday 12 to 2 p.m. we have a quick discussion on the questions in the mock test. Mock test on the web, you can take it on the anatomy2medicine.com, and on the app you can take it on the U-Medical. So I hope every week you become more and more strengthened and get ready more and more confident to the forthcoming NEET PG exam. Thanks for the patient listening.